Now, in the second section of our lecture, we will talk about another condition known as the esophageal burns. In this section, we will talk about the pathology of esophageal burns and also what are the stages of esophageal burns. Evaluation of the patient with esophageal burns and how we can manage this condition if the burn of the esophagus is present. So corrosive burns of the esophagus. So as the name shows, this is due to ingestion of the corrosive substances that can cause the burn of esophagus. And here if you see in the picture also, there is very bad burn of the esophagus. There is surrounding redness and ulceration, laceration present throughout when we ingest the corrosive material or corrosive substance. It won't only go and damage the esophagus but also the surrounding area in the oral cavity, gums, tongue, all that will be affected. The etiology or what causes corrosive burn of esophagus, the ingestion of acids, alkalis or other chemicals, sometimes by accident. A lot of people, if there is a bottle of bleach or any other substance present without any label. So it's very, very dangerous to put these substances or chemicals in the bottle which is not labeled. And even children, usually they don't read the labels and they think maybe it's something they can drink. And when they drink it, they take the liquid in that cause very bad burn of the esophagus and the oral cavity. So it's very, very important that as a safety measure, we should keep these material away from the reach of the children. And some people maybe they want to take it for the suicidal purposes and different reasons also. So, and this can cause the burn of esophagus. So acids, alkalis or other chemicals can cause burn. Swallowed accidentally in children, as I mentioned, very common in children. They ingest this or swallow it accidentally, mistaken by some other liquid they can ingest. So it's and then taken for suicide in adults. So these are some common reasons or etiological factors that can cause the burn of the esophagus. Pathology or the abnormality. Patho is the disease, ology is the study. So how the disease process occur or what are the damages that can occur with the ingestion of the corrosives. Severity of the burn of esophagus depends on the nature of corrosive substance. Some corrosive substances are really, really bad. They can cause immediate severe burn of the esophagus. Its quantity and concentration, how much is ingested. If the child who is taking it accidentally, they usually, if they feel that it's burning or it's not the good taste they want, so they usually stop it right away. But if it's taken for the suicidal purposes, the aim of the person is to harm, then usually the damage is more severe as compared to the accidental ingestion of the corrosives. Duration of contact with esophageal wall, again very important. If it is removed rapidly, it can cause less damage. If it is in the esophagus for longer time, it can cause very bad effect and damage of the esophagus. So all these are very important factors on which the damage is depends on. So nature of the corrosive, amount amount and concentration and the contact with the esophageal wall. Next, also the alkalis can cause the damage or burn of the esophagus also. They are more destructive. So it's important we should know that the alkalis are more destructive to esophagus. Penetrate deep into the layers of the esophagus. Why it is more destructive? Because it can penetrate or goes deep into the layer of esophagus, cause deep injury, deep damage, because all the layers of the esophagus will be affected. Lye burns our entire esophagus and stomach slough off and then cause fatal mediastinitis and peritonitis. So these are some different types of burns, can be caused by the corrosives, by the alkalis and the lye burns. The alkalis are more serious. They can cause the damage to all the layers of esophagus. In the lye burns, we have the esophagus and stomach. It's slough off and it can cause inflammation of the mediastinum and the peritoneal cavity. Peritoneum is the covering of the abdominal structures, so it can also cause peritonitis. Next, stages of the burn. Stages of the burn. First, there is acute necrosis. When any corrosive or alkaline material is ingested, whether due to for suicidal reason or accidentally, it can cause necrosis, death of the tissue right away. So first step, initially if it begins as acute necrosis. Necrosis is the death of the tissue which is attacked or which is in contact with the corrosive or alkaline material. Then there is stage of granulation. After the tissue is dead or it destroys the tissue, then there is formation of the granulation tissue. The slough separates, leaving granulating ulcer. So there is separation of the slough that is formed after the necrosis, and that slough, one remove, it cause the granulating ulcer, formation of granulating ulcer. Then in the third stage, there is formation of the stricture. As a result of granulation tissue, death of the tissue, there is formation of the stricture leading to the narrowing. So stricture formation begins at 2 weeks, continues for 2 months or longer. So that's how the corrosive material cause burn and burns is progress in 3 phases. First, there is necrosis, granulation tissue formation, sloughing of the granulation tissue leading to the stricture formation, begin in 2 weeks, can continue for about 2 months. And the stricture once formed, they cause the dysphagia, difficulty in swallowing, patient have pain on swallowing, and then there is it should be treated and dilation should be done so food can easily pass. Evaluation of the patient with the burns, determination of it's important, we should find out what type of substance was ingested, so type of caustic ingested. Signs and symptoms of shock, upper airway obstruction, mediastinitis, peritonitis, acid-base imbalance, and associated burns of the face, lips, oral cavity. So it's important that we should determine the patient, evaluate the patient for all these conditions. If the mediastinitis develop, if peritonitis develop, if there is any airway obstruction, if there is any associated injury present in the oral cavity, all that should be evaluated so patients can be managed properly and treated properly. X-ray of the chest and soft tissue lateral view of neck is done. Next, the management, how we can manage the patient, hospitalize the patient. It's very important. We should hospitalize the patient. Intensive care is very, very important. As with any other burn in any other part of the body, proper management is important because the burns, they can get infected, and then infection can spread and can even lead to septicemia or even death. So it's very important that patients should be hospitalized and isolated and properly managed. Treat shock and acid-base imbalance by IV fluids and electrolytes. Monitor the urine output for renal failure. Relieve the pain. Patient is in really bad pain. Relieve any airway obstruction by tracheostomy, and neutralization of corrosive by appropriate weak acid or alkali. So this is all very important that we should manage the patient in hospital, and then we should relieve the pain, look for the urine output. If there is any renal failure occurring, acid-base balance should be managed and patient should be treated very, very intensely in intensive care. Management, some other steps also. Antibiotics, as I mentioned, should be started immediately. Burns can very easily get infected and then can cause progress, septicemia, and infections. A nasogastric tube to feed the patient and maintain the lumen. Strictures will form with the burn to maintain the lumen so it won't close down. Its nasogastric tube, NG tube, should be put in the to feed the patient. Esophagoscopy. Steroids started within 48 to 96 hours. Follow patient with esophagogram and esophagoscopy every 2 weeks. So all these are very, very important management steps and should be performed. Development of stricture, we mentioned that in the last stage of the burn, strictures are formed. So if these strictures are developed, how we should manage these strictures? It is treated by esophagoscopy and prograde dilatation if permeable. Gastrostomy. A hole is made. Ostomy is the opening in the stomach. If the strictures are so bad that we cannot feed the patient, gastrostomy, and retrograde dilatation if impermeable. Esophageal reconstruction or bypass if dilatations are impossible. So strictures develop, we should, depending on whether they can be reconstructed esophagus and strictures can be removed, then we should do that. Otherwise, we should do the reconstructive surgery or bypass. So that concludes the esophageal burns, which was the second section of our lecture. Thank you for watching sqadia.com.